Good afternoon. Am I audible?
हॅलो हॅलो मॅम कोण आहे बोलतो?
Okay. So in the last lecture, we have started with the topic psoriasis. So we have already seen its definition. It's a Greek word meaning itchy condition. We have seen its WHO definition, epidemiology, causes, pathophysiology, its triggering factors, common sites affected by psoriasis, different types of psoriasis, like plaque psoriasis, gutted psoriasis, flexural or inverse psoriasis, pustular psoriasis, palmoplantar psoriasis, erythrodermic psoriasis, nail psoriasis, psoriatic arthritis. We have also seen the morphology of lesions like candle grease sign and Auspit signs are very important diagnostic features of psoriasis. And we have also seen differential diagnosis with its explanation like tinea corporis, discoid eczema, superficial basal carcinoma, seborrheic dermatitis, cutaneous T-cell lymphoma, pityriasis rosea, secondary syphilis, and after that, we also had seen treatment options for psoriasis. Then main homeopathic management. We also seen in last lecture in short the homeopathic management of psoriasis. As it is 20 marks question, I will repeat it again. Homeopathic management. So Hahnemann wrote in Organon of Medicine with reference to local maladies. That is, local diseases are a kind of one-sided diseases in which changes and ailments appear on external parts of the body. So the external local ailments cannot appear at all without the consent of whole of the rest of health and without the participation of living whole. As in the case of other chronic diseases, homeopathic case management in psoriasis involves careful selection of similibum. The constitutional remedy is to be given for long-term relief. As we know, psoriasis is incurable disease. It reappears. If we want to name it as a cured, we have to follow the patient for 15 years. Because within 15 years, it can relapse. So if in 15 years there is a no relapse, then we call it as a curable. Miasmatic view. Dr. Samuel Hahnemann classified psoriasis and its variant like psoriasis diffusa, psoriasis inveterata, and syphilitic psoriasis under the miasm psora. So psoriasis developing in specific locations of the body such as eyebrows, on back, on upper limbs, over elbows, forearms, hands, palms, fingers, and on legs are also classified under psoriatic miasm. What Dr. H. A. Roberts says in his book, The Principle and Art of Cure by Homeopathy, the psoriasis is marriage of all the miasms. So predominantly, there is a psoric and psychotic miasm. We had seen the differentiation or presentation of psoriasis in different miasms. Like in psora, There is a dryness which predominates. Fine and thin scales. Tendency for recurrence. Skin cannot endure the water. There is a itching which is persistent itching. Very little separation. Aggravation in open air. Aggravation evening. Better by scratching, but burning and smarting follows by scratching. Mentally, these patients are alert, quick, active, restless, and sensitive. The psychosis presentation, the fish scale eruptions, pruritus with thickening of the skin pigmentation, aggravation by change of weather, aggravation by meat, nails are irregular with thick ridges, joints and connective tissues are also involved with self-condemnation, like syphilitic. In tubercular miasm, nails are irregular, brittle, breaks and splits easily with many hangnails. Also spotted with white specks. The psoriasis of tubercular patient is very obstinate and difficult to cure. There is a recurrence, periodicity, alteration of symptoms. Hemorrhages are characteristics. In syphilitic miasm, nails are paper-like, spoon-shaped, bending, tearing easily. Mentally, they are dull, heavy, stupid, stubborn, sullen, and morose. They are depressed and condemn themselves, and they are better by abnormal discharges like leukorrhea and catarrh. Then these are some rubrics, different repertories. Then we have seen different remedies like earth iode, sulfur, calcarea salt, mesothelium, graphitis, soranum. Then today we'll see one case of psoriasis which is treated with homeopathy. So preliminary data. Name Mr. VD. Age is 32 years. Male patient. Hindu. Address is Wakad, Pune. Education is 10th. Occupation business. He is married. The date of examination or date of case taking is 12/11/2018. His socioeconomic status is middle class. The chief complaint is skin eruption on both legs and elbows since 7 to 8 months. What is his chief complaint? Skin eruptions on both legs and elbows since 7 to 8 months. You can see the eruptions. See the silvery scale. See the silvery scale. Then ODP. Onset, duration, progress. Patient was apparently alright 7 to 8 months back. Then he gave an history of skin eruptions, which is started gradually. It first started from right leg, below the medial malleolus, then chin of tibia, then left leg near lateral malleolus, then left shin of tibia, then it spreaded to right elbow extensor surface, then to left elbow extensor surface, and then to skull. These all eruptions are along with itching which is 2 marked. Aggravation is evening, 2 marked. After reaching aggravation, and it is better by oil application, and occasionally bleeding is also there. So how complaint started? The patient was apparently alright 7 to 8 months back. He gave an history of skin eruptions, which is gradually started, slowly started, since 7 to 8 months. It first started from right leg below the medial malleolus, then shin of tibia, then left leg near lateral malleolus, then left shin of tibia, then right elbow extensor surface, then left elbow extensor surface, then on the skull. All these eruptions are along with itching, which is aggravated by evening, after scratching, and better by oil application. And also there is occasionally bleeding. For same complaint, he took allopathic treatment but had temporary relief, and eruptions came back again. No complaints of joint pain or stiffness. Also, there is no history of local trauma, long-term medications, radiations, infections, or contact with chemical agents. In case taking, the negative history is very important to rule out the causes and also to rule out differential diagnosis. So there is no history of local trauma, long-term medication, radiation, infection, contact with chemical agents. Then in past history, no history of similar illness in the past. The all complaints are started since 7 to 8 months. There is no history of hypertension, diabetes, bronchial asthma, TB, CVA, CA, varicose veins, or any other major illness in the past. Then in family history, his mother also has psoriasis. Father is having diabetes. And in family history also, there is no history of hypertension, bronchial asthma, TB, CVA, CA, or any other major illness in the family. Then personal history. In personal history, there is no recent change. All changes are his constitutional, or all symptoms are his constitutional. His appetite is normal, like chapati thin and 1 katori rice 2 times per day. His diet was mixed, desires sweet 2 plus and milk 1 plus. Aversion not specific. There is a thirst. Patient was thirsty, only 1 plus for large quantity of water at long interval of normal temperature water. Thermally, he is hot. Then in urine complaints, 4 to 5 times per day, urine is clear, pale yellow with no any complaints. Bowels are soft, satisfactory. Sleep is sound, refreshing. Dreams not specific. Perspiration scanty but all over the body. There is no odor or no staining. Then life space. He is born and brought up in Pune, stayed in joint family, having 2 brothers, and he is first child in the family. Childhood, he belongs to lower class family, good relations with siblings, average in studies, used to like to participate in extracurricular activities, for example, dancing, skits, speech. He had a lot of tension as a child because there was a constant quarreling between mother and father. His father was alcoholic and non-working. Mother was working as a maid. His father used to beat him and his mother after drinking. So how was his childhood? He belongs to lower class family, good relations with siblings, he was average in studies, used to like to participate in extracurricular activities, for example, dancing, skits, speech. But he had a lot of tension as a child, as he was first child in family. There was constant quarreling between mother and father. His father was alcoholic and non-working. Mother was working as a maid. His father used to beat him and his mother after drinking. He could not complete his education after 10th because of financial condition of family and started working in grocery shop after 10th. But he provided money to educate his 2 brothers. At the same time, he has hatred to his father, which is 3 marked, because due to him, he can't complete his education. He could not complete his education after 10th because of financial condition of family and started working in grocery shop after 10th. But he provided money to educate his 2 brothers. With that, he has hatred to his father, which is 3 marked, because due to him, he can't complete his education. Now, he is having his own grocery shop. In his shop, 2 workers are working with him. His marriage life, he got married 5 years back, which is arranged marriage, good relations with wife, and having single male child. Since 1 year, he is having stress in relation with his brothers, as he is having joint family, but his brothers wants to get separated, but he don't want. Due to that, there is constant quarreling in between them. What he said, मी त्यांना एवढे शिकवले आणि आता ते वेगळे राहायला म्हणत आहेत. मी कधी त्यांना कशाची कमी पडू दिली नाही आणि ते आता माझे काहीच ऐकत नाहीत आणि मला काही विचारत सुद्धा नाही. So I had taken a rubric elements from discord between relatives. So what happened? Since 1 year, he is having stress in relation with his brothers. They wants to get separated, but he don't want. And due to that, there is a constant quarreling in between them. And what his feelings, he said, मी त्यांना एवढे वाढवले, शिकवले आणि आता ते वेगळे राहायला म्हणत आहे. मी कधीच त्यांना कशाची कमी पडू दिली नाही आणि ते आता माझे काहीच ऐकत नाही, मला काही विचारत सुद्धा नाही. So taken the rubric elements from discord between relatives. He wants everything neat and clean and cannot bear uncleanliness in his shop. He makes clean everything by himself. So the rubric is fastidious. If anything is not on its place, he gets angry but not expresses his anger. And in the family also, he not expresses anger. So there is a suppressed anger. What he feels about his disease, he had become so anxious about the appearance of skin. He has visited many doctors but not getting complete relief. What he thinks about his disease, he had become so anxious about the appearance of skin. He has visited many doctors but not getting complete relief. What he said, लोक काय विचार करत असतील माझी स्किन पाहून, मला नाही आवडत कोणी माझी स्किन पाहिलेली, त्यामुळे मी शॉर्ट्स और टी शर्ट्स नाही घालत. सो व्हॉट इज द रुब्रिक? हायडिंग डिझायर फॉर. व्हॉट ही सेड, लोक काय विचार करत असतील माझी स्किन पाहून आणि मला नाही आवडत कोणी माझी स्किन पाहिलेली, त्यामुळे मी शॉर्ट्स और टी शर्ट्स नाही घालत. सो ही ट्राइज टू hide the eruptions. So hiding desire for. And he said, मला लवकरात लवकर बरे करा. So carried desire to be fast. This is the rubric. Carried desire to be fast. So overall, the rubrics are talkative, hatred to father, elements from discords between relatives, fastidious, suppressed anger, hiding desire for, carried desire to be fast. So these are the rubrics. Talkative, hatred to father, elements from discord between relatives, fastidious, suppressed anger, hiding desire for, and carried desire to be fast. The general examination. Built and nourishment. Average well built. Weight is 60 kg. Height is 5'7" feet. Whitish complexion with black hair. Tongue is clean, moist. All pallor, edema, icterus, cyanosis, clubbing, and lymphadenopathy was absent. Then vital data of febrile patient. Pulse is 76 per minute. BP 130 by 80 mmHg and RR is 18 per minute. Then local examination. In local examination, first inspection, sight, right leg, below the medial malleolus, 2 lesions were there. Largest approximately 3 centimeter and smallest is approximately 2 centimeters. On chin of tibia, approximately 7 to 8 centimeter lesion. On left leg, near lateral malleolus, 3 lesions were there. Largest approximately 3 centimeter and smallest approximately 1 centimeter. And left chin of tibia, multiple lesions approximately 2 centimeter. On left elbow, The lesions present on extensor surface. Multiple lesions approximately of 1 centimeter. Right elbow, extensor surface, tiny, multiple lesions approximately 0.5 centimeters. So see how to write the inspection and the lesions of psoriasis or of eczema, any type of skin eruptions. How to write? Then margins are irregular and elevated. Scaling, silvery white scaling is present. Discharge, occasionally bleeding, which is non-offensive discharge. Then palpation, the lesions are rough to touch. Auspit sign is positive. What we have seen, what is auspit sign? Auspit sign is small bleeding points seen upon disruption of psoriatic skin. Means when we remove the scale of that eruption, under that scales, there are small bleeding points. So it is the diagnostic symptom of psoriasis. Auspit sign. No tenderness present. Local rise of temperature is absent. And no bleeding on touch. So what is in local examination? How to write? In inspection, we have to write the site, its measurements, margin, irregular or regular, elevated or at the skin level, scaling are present or not, or how scalings are there. Here, silvery white scaling are present, any discharge, and in palpation, how it feels to touch, like psoriasis eruptions, rough to touch, and any sign, like auspit sign is positive here. What is auspit signs? Small bleeding points seen upon the disruption of psoriatic scale. No tenderness present. Local rise of temperature is absent. And no bleeding on touch. Systemic examination was normal. CVS, S1, S2 hard, no murmur, or abdomen soft, non-tender, and no any organomegaly. In CNS, conscious and oriented patient. And in respiratory, air entry bilateral equal, and it is clear. So what investigations are advised? As auspit sign is positive, we have diagnosed clinically it as a psoriasis. But for confirmation or ruling out other diseases, we can advise patient SOS skin biopsy. It is SOS. So differential diagnosis, plaque psoriasis, eczema and T-cell lymphoma. As auspit sign is positive, eczema is ruled out, and T-cell lymphoma, we can diagnose it after skin biopsy because the lesions looks very similar. Then provisional diagnosis was plaque psoriasis. Then analysis of case, type of disease is chronic, phase of disease is structural, Hahnemannian classification of disease is dynamic, chronic disease, miasmatic, fully developed with psychosyphilitic miasm. Curability of cases, incurable. Then analysis of symptoms. In mentals, he is talkative, hatred to father, elements from discords between relatives, fastidious, suppressed anger, hiding desire for, and carried desire to be fast. Then in physical generals, desires for milk, desire sweet, thirsty for large quantity of water at long interval of normal temperature. And physical particulars, skin eruptions on both the legs and elbows, itching to mark, aggravation evening after scratching, and better by oil application. Then evaluation. Then in evaluation, I have taken first as the elements from discord between relatives. Hatred to father, talkative, fastidious, suppressed anger, hiding desire for, carried desire to be fast, desire sweet, skin eruptions on both legs and elbows, skin eruptions with itching, itching aggravation evening, desires milk, thirsty for large quantity of water at long interval of normal temperature, skin eruptions which is aggravated after scratching, skin eruptions itching which is better by oil application. So these are the rubrics taken for evaluation of case. So it is converted to the rubrics. You can read like elements from discord between relatives. I found out the rubric. Mind, elements from discord between friends or relatives. Hatred to father. There is no specific rubric for hatred to father. So taken the general rubric. Mind, hatred. Then talkative, mind, loquacity. For fastidious, mind, fastidious. Suppressed anger, mind, elements from anger suppressed. Hiding desire for, mind, hiding himself. Then carried desire to be fast, mind, carried desire to be carried. Desire sweets, general food and drinks, sweet desire. Meeting will end in less than 1 minute, so you can rejoin again. Skin eruptions on both legs and elbows with itching, aggravation evening, after scratching, better by applications. These are all rubrics taken for you. That is extremities, eruptions, skin eruptions, psoriasis, skin eruptions, itching, skin eruptions, itching evening, and skin itching, scratching aggravates. Then thirsty for large quantity of water at long intervals of normal temperature. The rubric is stomach, thirst, large quantities for long intervals at. So these are the rubrics taken for the solving of the case. This is a Patil sheet. You can see on your screen. Repertorized by radar with synthesis repertoire. Then in repertoire sheet, you can see the close coming group of remedies. That is sulfur, staphysagria, natrum mur, arsenic, lachesis. So these are close coming group of remedies. Sulfur, staphysagria, natrum mur, arsenic, lachesis. So these are close coming group of remedies. Final remedy which I had given was sulfur 200 single dose with SL4 globules TDS. These are the follow-ups. On first day, that is on 12/11/2018, I had given sulfur 200 single dose with SL for 15 days. Then on 26/11, itching mildly decreased, but dryness was still present. So continued with SL. On 10th of December, itching is decreased and also dryness and scaling is also decreased. So SL is continued. On 24th December, itching decreased, dryness, scaling decreased, and size of lesions also decreased. So continued with SL. And on 8th of January, itching decreased, dryness decreased, scaling is decreased, the size of lesions are decreased, and no any new lesion is formed. Only dark pigmentation is remaining. So continued with SL. So you can see in the images. The first one is on case taking, that is 12/11/2018, and it is on the 8th of January. You can see the scales are decreased, dryness is also decreased, and on 8th of January, only dark pigmentation is remaining. See the difference in images. So have you seen the changes after giving sulfur? Only single dose within 2 months. See again, first image, and this one is after follow-up. The sulfur was given on 12th of November and you can see the result on 8th of January. The changes in the eruptions. Thank you. So any doubt in psoriasis? Can you write the 20 marks question? If any doubt, you can call me or message me.